right, thank you, and welcome. So, therefore, fellow Africans, being on 27th of January 2025, I am once again humbled and honored to bring to you our 11th episode, which doubles up to be our first pillar of the Change for African campaign, and that is the governance that we want in Africa. So therefore, fellow Africans, first and foremost, before I proceed, I wish to bring forth my respectful submission for bringing this late. It's because I was a little bit equipped with some of the activities here and there. I was submitting some of my assignments at the African Leadership X, or the LX, where I do some studies. Putting that aside, fellow Africans, being on Monday, as usual, and I've said it before, it's about governance. And since we started governance, this is the third episode. We have done two. So, with respect to our usual routine, it's that on governance in Africa, because this is about issues affecting Africa and solutions that can be found for Africa, we try and see and look at the UNSDG goals, or the United Nations Sustainable Development Goals that were adopted in 2015, and they have there's what we call the Vision 2030. It's a global thing, the Vision 2030. We have 6 years too. It's not 6 really, but yeah, 2025. We have 5 years too. So that's it. So the aim for, they have 17 goals. So far so good. In the first episode about governance, if you remember well, we tackled our first goal, which is about the hunger, or things to do with hunger in Africa. And then our second pillar on governance, which was last week on Monday, we did tackle things to do with the quality education. That is also one of their goals. It's goal number 4. So today I would love us to have just a glimpse of one of the other goal of the United Nations Sustainable Development Goal, and that is goal number 3. Goal number 3 states that good health and well-being of all of people around the globe, good health and well-being. And so here we won't much focus on the global picture, but we'll be focusing on the great Africa, because Africa is a land of great potential. The only thing holding Africa, it is the software of Africa, and the software of Africa and the software of development in Africa is what we call the governance that we want in Africa. So therefore, fellow Africans, welcome. Let's dive into this. To help us proceed under this discussion will be under the well-being and good health and well-being as one of the goals of the United Nations as one of the goals of the UN under the United Nations Sustainable Development Goal will be, what were the aims of this goal number 3? What were the aims of good health and well-being? So the aim number 1 for this one, they have several, but I will want us to only try and look at about 3 of them, or 4. So their first aim was to promote healthy lifestyles and well-being of the people. The other one was to reduce the global maternal mortality death. And then the other one was to end preventable death of newborns and children under the age of 5 years globally. And then the other one was fight communicable diseases. So those are 4. They're about 8 or 10 or so. So those are only 4. So I will want us to go through this and see the state of Africa in this discussion, in all this discussion, because for us to achieve this, we need to have a very pragmatic kind of leadership, whereby We have people who understands what needs to be done, or people who are visionary in Africa. We need visionary leaders, and that is why the Change for African campaign's aim is to make sure that we do not rush for anything like power, but we first civilize the youth of Africa and see how the youth can cope with this. And after they have realized that this is where we are going wrong, after they have realized that we are facing the same problem, that is when now the African youth will develop the same intention. So therefore, fellow African, that aim number one about healthy lifestyles and promote well-being, as we all know, the fact of the matter is healthy lifestyle in Africa, it is still a very, it is something to covet, it is still something to covet. We are yet to be there. We still have a long journey to go when it comes to well-being and promote and healthy lifestyle. Because you remember the other day when I talked about Somalia, I think it was about the pillar number 5, which is climate change we face in Africa. You remember I was speaking about how it is in Somalia, whereby in the health sector, it is said that, or according to the research and good statistics that I went through, it is said that a very huge population of Somali, they have no access to quality health in Somalia. That is another very huge problem in Somalia, that they either totally have no access to quality health care in Somalia, which is also a worrying situation. And then number 2, so that's the fact of the matter. And then number 2 about reduce the global mortality death rates or death cases. Generally we are not there. We are also still not there, because it says that in Africa still 75 deaths per 1,000 lives is reported. In every 1,000 lives, 75 deaths are reported, or every 1,000 children that are born. That is what I mean. 75 of these children die in Africa. But we have been having still Africa. It's whereby it's not balanced. Whereby some regions maybe have something lower than that or higher than that. So that is also still another very cognitive issue of discussion of whether we are making a step as Africa as a whole, because we need to have that collective growth as a continent. So that is when you call for something called unity. Unity will lead us to there. That is why we, the youth of Africa, we have to start from here, unite first, and then realize that we are facing a particular problem, and then have a designed cognitive discussion and ideas to promote our success, or for us to succeed. And then number 3 is about to end preventable death of newborns and children under the age of 5 years, to end preventable death of newborns and children under the age of 5 years. It is also, some countries, yes, in Africa have made steps, but here you still have a very great disparity in terms of these different parts, because some places like Southern Sudan, that is happening at a very high rate, because actually in Southern Sudan, or even in Somalia and the other countries, you realize that what we call the infrastructural facilities in these countries, we cannot speak about them totally. We cannot speak about them, and that is Africa. And Africa is a land of great potential. But when you see the states in which we have, or the facilities of health we have in these countries, it is very worrying. In very dilapidated conditions that cannot support good healthcare system. So it's still also an issue of discussion, because we have what we call malnutrition. In these countries, you realize that not many people, maybe the government even do not have even enough qualified medics, personnel. We do not have these health facilities. Even the drugs themselves, we do not have. That is another problem, a very huge problem that this one has been. It has not started today. It is an issue that has started long ago, and it's still just going on. And if we do not have some pragmatic actions or steps to take as early as possible as today, we are going to have a very terrible future as the young population of Africa. Remember, Africa's population, or the younger population of Africa, Africa accounts to about 70% of the Africa's population is of young age, about approximately there. What does this mean for our future? It means that if all this population, currently this is the state, what about 10 years from now, 50, our future generations, what about them? So it is an issue whereby we just need never to avoid that, but to make sure that we discuss that and get the great solutions for it. And why we discuss about governance and such issues are discussed under governance is because lack of poor or presence of poor infrastructural facilities. We do not have drugs, we do not have this one, and yet you have people here. We have people who do collect taxes, we have the resources, and yet you do not have the essential services, the essential needs, the basic fundamentals, all those things. You do not have them. Then it means that the governance is leaking somewhere, and that is why I said that the current political system or the governance in Africa is a system that was coded so many years ago that we need some repair of that. We need new coding of that system. So for us to fit in that, we are totally not compatible to the current system, because it was coded so many years ago. So we need a revolution of Africa, and that is what we are calling the unity of the people of Africa. The governance we want in Africa is here to stay. The last point, or the last aim for this UNSDG goal number 3 of discussion today was to reduce the global, not reduce really, but to end, not that one really, but to fight communicable diseases in Africa. A quick peruse over this. We want to see an example of communicable diseases is HIV, human immunodeficiency virus, HIV. So, how is HIV? What is the state of HIV in Africa? According to the crystal clear research I've gone through, is that the sub-Saharan Africa accounts to over 70% of the total, or to about 70% of the total global HIV lives globally. Sub-Saharan Africa only 70%. What is that really? And the iron of that is that Africa actually really the only powerhouse that is able to manufacture the ARVs, or the drugs meant to aid people living with to help people living with HIV and AIDS. The only country that maybe has a greater capacity, and it has done that because it's the leading country in the cases of HIV globally, is Southern Africa, which is about 7.7 million people living with HIV in Southern Africa. And then only one country, because India is number 2 with about 2.2 million people living with HIV globally. And then when we take away India, we are remaining with 9 countries in top 10 that have very high cases of HIV and AIDS. To the iron of that, and then if you remove the country known as Southern Africa, we remain with 8. Because South Africa actually sustains itself in terms of they manufacture. They have a very huge manufacturing capacity. But then the other countries, the other 8, Kenya included, which is number 4, Nigeria is number 3, Nigeria is number 3, they do not manufacture anything like ARVs for their people. Meaning, they still, or we still import. All the other African countries, or many of the African countries, hugely, they depend on importation of the ARVs to cater for their people living with HIV and AIDS. What is that really? Africa in the 21st century, that is a very, what can I term that? It is a very annoying state. It's a very awkward statement that we still import some of these things. Very critical things for them in terms of the livelihoods of our people in Africa. When you say about well-being, how are we doing that? Remember, recently, the US contributes to about 15 to 20% of the total global funds to the WHO, the World Health Organization, which is responsible for health globally, an organization about 15 to 20%. And what did the USA do the other day? They withdrew from that because the president signed that order for them to withdraw from that organization. What is next for this? And then also have what you call the President's Emergency Plan for AIDS Relief. This is also another fund. It's a fund known as PPFAR. PEPFAR. It is whereby the President's Emergency Plan for AIDS Relief. Also, the same United States of America contributes to about 60 to 70% in this fund to help people living with these kinds of with HIV globally. So the problem is the USA have withdrawn. So what is the next step for countries in Africa? Because countries in Africa hugely depend on donations from such countries. So USA have withdrawn, meaning it is time for Africa to wake up. It is time for Africa to arise and think on its own and have its own way of thinking and doing things, and just try to live on their own. Because until when will we continue to be beggars of other sides of the globe? We have the capacity, we have the potential, we have whatever it takes. We can harness whatever we have to reach to new levels and make Africa great. So therefore, fellow Africans, I have spoken too much today, and I think that one will be marking the end of our presentation about the governance we want in Africa. Until that day that governance will change, we have visionary leaders, people who understand what we want, then that is when all this will be able to be achieved. Unless or otherwise, the UNSDG goal number 3 remains to be a mere dream for Africa. Thank you. Good afternoon.